Focus now on COVID-19. New research on how long the coronavirus can remain on clothes and fabric has just been released, and it shows the virus can stay alive for up to 72 hours on some materials, such as polyester, and it can still be transferred at that point to other surfaces. The research was done at Montfort University in Leicester in the United Kingdom, and I'm joined by Dr. Katie Laird, head of the Infectious Disease Research Group at that university. Good evening, Doctor. Thank you so much for your time. So this study primarily was about trying to find out how long the virus can cling to the uniforms, the clothes, and the protective gear that health workers wear when on the front line of fighting COVID-19. What did you find that was possibly new and unexpected? Because we've known there's some possibility of it sticking to our clothes. What did you find out that was new?
There was very limited data on the survival of coronaviruses on textiles generally. So what we did was we set up a model microorganism that behaves in the same manner on surfaces as COVID-19. And what we found was we tested 3 textiles, a polyester, 100% cotton, and a polycotton blend. And what we found was polyester, which didn't absorb the respiratory droplets with the virus in, the survival of the coronavirus was much longer, so 72 hours. The 100% cotton, where we saw more absorbance, was 24 hours, and the polycotton was 6 hours. But we believe that the polycotton textile had some type of finish on it, which was slightly cytotoxic to the mammalian cells that we grow the virus in anyway. So we think there was some type of antiviral process in some of the finishing that went with the polycotton.
So polyester, the virus can cling to and stay alive on for up to 3 days, and others, 100% cotton, 24 hours. What is your understanding of why certain fabrics can keep the virus alive longer than other fabrics?
We believe that the absorbent properties of the textiles is desiccating, so drying out the virus. So with a natural cotton where it's been absorbed, we believe that that's drying the virus out and therefore it's not surviving as long. But when we did the work on the polycotton, the virus within the respiratory droplets was sitting on the surface, and that's why we also think that it was more easily transferred to other surfaces. We looked at other textiles, and we also looked at plastic at time periods across the 72 hours. We showed that the virus, although it was reducing over that time, so it started off with a high viral load, and by 72 hours it was a relatively low viral load. During that entire period, it could also transfer onto other stuff. I
mean, it's completely fascinating research. But realistically, if you were to, say, wipe your hand, let's say you're COVID-19 positive, on a polyester dress, and then pick it up, someone else picks it up 3 days later, would it be possible for that virus to transmit from fabric to the hand and possibly even infect that person?
We haven't done that research, so it's hard to say, and our focus particularly was on the healthcare environment, because in the UK, nurses domestically wash their uniforms, so they're going into a high-risk area where they might get high contamination and then having to take that uniform home in their car or into the home environment where they may be living with vulnerable people. So I think in day-to-day life, we shouldn't be too worried about it, because the other research that we did do was how to remove the virus from the textiles. We looked at a whole range of different washing parameters, including industrial washers, on-site laundries, domestic washers. And we looked at that in the presence of saliva, because if you think about the respiratory droplets that come out as we breathe, that's how the virus would be. And we showed that the domestic machine didn't perform as well when there was no temperature detergent as the bigger industrial machine. When you added in detergent and temperature at 40 degrees, it was quite readily removed. So washing does remove the virus. So I think if anyone has any concerns, really the best thing to do is to just wash their textiles on a regular basis if they think they've been in contact with someone that has COVID or been in a high-risk area.
I mean, is this yet another reason to avoid polyester?
I say nothing. Well, it's sitting on the surface. we've seen reports of plastics that are able to harbour the virus for longer, etc.
I mean, it's absolutely important that we learn about this stuff, because it's all about, I mean, you know, we're having a giggle, but it's very much about how to protect our healthcare workers as much as possible. Do you think any of this research could be used potentially to change the materials? Because the three materials you chose, cotton, polycotton and polyester, are very often used, I understand, in some of the protective equipment and some of the uniforms that are worn by medical staff. Do you think it suggests that perhaps different materials should be chosen?
I think when we're talking about PPE, most of it is washed industrially or on-site from those high-risk wards anyway. It's more the nurses that don't have those facilities that it's of concern. There is lots of textiles out there that are now beginning to look at antimicrobial coatings. So you'll have an antiviral within the textile, which is quite a good idea. But the type of textile, so if a polycotton we know reduces the survival of the virus, then it may be a better option. But then you come into the issues of polycottons are not so recyclable. So it's end of life use and things like that as well. So it's a much bigger picture.
Well, you started a fascinating conversation. Your research is so interesting. Thank you very much for chatting to us this evening. Dr. Katie Laird, head of the Infectious Disease Research Group at Montfort University in the United Kingdom. And their research shows COVID-19 can survive for up to 3 days on polyester, 24 hours on cotton. So fascinating research, all done to try and keep healthcare workers as safe as possible, but leading to some fascinating insights into the future of microbial materials and how we can stay as safe as possible.